One of the other questions which people have been asking is, breastfeeding, pregnancy, menstruation. During those times, can we take the vaccine? And that has been quite a common question, especially, ma'am. What are your thoughts on it? What is your
Um,
experience?
Thanks, Linga. As far as menstruation goes, the timing of menstruation or any time in your period cycle, there is absolutely no contraindication. You can take the vaccine at any time, even when you're on your periods. You can have the vaccine. As far as breastfeeding is concerned, there is current evidence to say you actually should get the vaccine when you're breastfeeding. Pregnancy is a specific condition when we know that when you get infection during pregnancy, especially after 28 weeks of pregnancy, the risk of complications is very, very high. The current guidance and evidence is that you need to get vaccine or should be offered vaccine when you're pregnant because it does reduce the complications during pregnancy. There is also evidence to say that premature labor, premature delivery, the risk is brought down by getting the vaccine. So definitely consider getting the vaccine when you're pregnant. If you have any doubts, as we said, please do speak to your obstetrician as to when you should get the vaccine, and they should be able to advise you.
But in India, the rules are a bit different. So we'll have a separate session with one of the senior obstetrician and gynecologists as well to clarify our stand on it. I think certain rules, if I'm right, ma'am, in UK, these have come off late as April 16th is what I've told. So the data is still evolving with regard to pregnancy, with regard to breastfeeding. But in India, regarding the latest stance, definitely yes, during menstruation, it is not a contraindication. During pregnancy and breastfeeding, people are not allowed to get vaccinated. But as we say, we'll update with regard to that. And we'll have a special talk with one of the senior obstetricians to highlight our stand, our experience from the Indian setup with regard to it.
Thank you, Dunga. I think that's very important. We are talking about myth busting and we don't want to create a new myth. So just to summarize from these two doctors, one is there is no issue with menstruation. Pre, post, during, you can take it. Second, breastfeeding, there is really emerging evidence that it is safe, it is effective, and also there is a tiny bit of evidence coming. Even the newborn baby might even get some antibodies through the mother. So it is also slightly next. The last point is pregnancy. It is still day by day, week by week, the information is evolving. We will put the UK guidelines and the US evidence in the description. However, in India, I'm sure with all these amounting evidence, our colleagues, our specialists will consider this, but don't use that to run away. Again, go and ask, when can I take? I think that's the thing. Rather than can I not take, is when can I take? As Dr. Shanti explained, the complications after 28 weeks with COVID outweighs some of those things. So keep an eye on this description. And also, as Dr. Linga mentioned, we will get one of our senior obstetrician to give us a bit more advice. We'll do it in a matter of a couple of weeks so that by then we may have more evidence. So thank you for that.